Good day to you all. I'm Buddhima Kaushalya from the Faculty of Information Technology, University of Moratuwa, Sri Lanka. It's both a privilege and an honor to present my independent research study titled Detection of Multiple Sclerosis Lesions in Brain MRI using Fuzzy Wavelet Transform. This presentation focuses on an innovative approach that combines image processing techniques with fuzzy logic to support early and accurate diagnosis of multiple sclerosis. Here is a brief outline of what I will be covering in this presentation. I will begin with a brief introduction to the topic and then move on to state the aim of this research. Following that, I will provide the background context and then discuss related work in the domain. I will then explain the challenges I encountered during the study, followed by a discussion of key insights and findings. Finally, I will conclude it with a brief note on potential directions for future work. We move to the introduction. Multiple sclerosis, or MS, presents a significant clinical challenge largely due to the presence of elusive and irregular brain lesions. Early detection of MS is crucial as it allows for timely intervention and more effective treatment outcomes. However, even with the remarkable advancements in MRI technology, accurately identifying MS lesions remains a highly complex task. In this study, I explore the integration of AI and fuzzy wavelet transform as a novel and promising solution to enhance the detection of MS lesions in brain MRI scans. This approach has the potential to revolutionize how we approach MS diagnosis, paving the way for more accurate and automated detection methods. When we move to the aim of the study, the primary object of this independent study is to develop an effective method for the detection of multiple sclerosis lesions in brain MRI scans. This is achieved by leveraging a hybrid approach that integrates fuzzy wavelet transform with advanced AI techniques aiming to enhance accuracy, adaptability, and reliability in lesion identification. When we move to the background of the study, my motivation for this study is deeply rooted in personal experience with multiple sclerosis, which has provided me with the first-hand understanding of its symptoms, diagnostic challenges, and treatment pathways. This personal connection sparked a deep curiosity about how clinicians accurately identify MS lesions through brain MRI scans, a process that, while fascinating, is also highly complex. Combined with my academic passion for computational mathematics and AI, this interest has driven me to explore innovative solutions to enhance MS lesions detection. With that foundation in my mind, let's delve into the technical aspects of the study. Related work, multiple sclerosis. So let's see about what is multiple sclerosis. So multiple sclerosis is a chronic and complex autoimmune disorder that targets the central nervous system, particularly the brain and the spinal cord. It most commonly manifests in young adults aged between 20 and 40 years and is characterized by inflammatory demyelination and axonal disruption, which together lead to the degradation of the myelin sheath, the protective layer surround nerve fibers. While MS does not typically reduce the life expectancy, it significantly affects the quality of life, often impairing sensory and motor functions, autonomic control, and cognitive abilities, depending on the severity of and location of the lesions. So let's move to the risk factors of MS. This visual provides a comprehensive overview of the pathogenesis and clinical impact of multiple sclerosis. On the left, we see a range of early life risk factors that have been associated with increased susceptibility to MS, including smoking, obesity, head injuries, childhood infections, family history, and low vitamin D status, among others. And these factors may contribute to abnormal autoimmune responses, specifically autoinflammation of the myelin sheath shown in the center. And this process leads to demyelination, which disrupts neural communication in the central nervous system. As a result, individuals may experience a variety of neurological complications shown on the right, such as fatigue, numbness, muscle weaknesses, tremors, joint pain, and even respiratory difficulties. With the severe cases. So, understanding this chain of causality help highlight why early detection are so critical in managing MS effectively. So when we move to the next slide, you can see this map illustrates the global distribution of countries affected by multiple sclerosis with a notable impact, particularly in the United States. So in the next, identifying MS using MRI. Unlike CT scans and X-rays, MRIs are not harmful because there is no ionization. MRIs use strong magnetic fields and radio frequency pulses to create images. Damaged areas with reduced or absent myelin have different water content compared to healthy tissues. So this difference allows MRIs to detect lesions which appear as bright or dark spots. So there are three main approaches to detect lesions. First one, semi-automated method, which combines human expertise with automated algorithms, enhancing precision in identifying brain tissue and marking lesions. Then the second method is supervised methods, trains computer programs to learn patterns in intensities, enabling accurate lesion segmentation. The third one, fully automated methods, utilizes models-based strategies, atlas-based approaches, and texture feature maps of automated lesion detection and tissue classification. So next slide, when we see about fuzzy wavelet transform, this approach combines the strength of two powerful methods, fuzzy systems and wavelet transforms. Fuzzy systems are designed to handle uncertainty and imprecision, making them particularly effective in medical imaging, where boundaries between healthy and affected tissue can often be ambiguous. On the other hand, wavelet transforms are widely recognized for their capabilities in signal and image processing, particularly for analyzing data at multiple resolutions. The fuzzy wavelet transform, or FWT, leverages both these strengths. It enables an adaptive and complex aware representation of MRI signals, allowing for more nuanced and localized analysis of MS lesions. This technique is already applied across various domains, including signal processing, image enhancement, data compression, extraction, and proves highly effective when precision and flexibility are required. In the context of MS detection, FWT helps. Fuzzy wavelet transform helps capture subtle variations in improving both the sensitivity and specificity of lesion identification. In the next slide, when we see the advantages of fuzzy wavelet transform in medical imaging, offers several notable advantages, particularly in the medical imaging domain. Firstly, it provides improved adaptability to diverse and complex medical data, accommodating variations in image quality, patient-specific anatomy, and lesion characteristics. Secondly, it enables enhanced edge detection and feature preservation, which is crucial in accurately identifying the boundaries of MS lesions, especially when they appear faint or irregular. Finally, the method allows for the effective fusion of complementary information from different imaging modalities. Together, these advantages significantly strengthen the system's diagnostic reliability and performance in real-world clinical settings. So when we move to the next major findings, this table presents a summary of significant findings from the recent research studies that utilize fuzzy logic and wavelet transform-based approaches in various applications. In 2024, Dr. Kizar Hayat proposed a method in the discrete wavelet transform, fuzzy C-means clustering, and kitsch edge detection, or from MRI brain lesion segmentation. The study reported enhanced edge clarity and increased resistance to noise in lesion detection by using sharpened wavelet images. J. Prakash and colleagues in 2023 applied a combination of the discrete wavelet transform and fuzzy logic systems with segmentation for medical image fusion. Their approach incorporated techniques such as I2CACIS segmentation, Gaussian membership functions, and the Mamdani inference system. In a separate domain, Saif Ahmed and al. Used a wavelet-based preprocessing approach along with fuzzy logic forecasting to improve economic time series forecasting, and their method effectively handled multi-scale behavior and autocorrelation patterns. So in the next slide, when we move to the next slide, these are the challenges. During my research, there are very few studies effectively integrate fuzzy logic and wavelet transforms with AI for MS detection. And existing papers often treat these techniques separately or focus only on traditional image processing. And as well as most researchers emphasize lesion detection rather than aiding clinical diagnosis or tracking disease progression. And there is a lack of reviewed papers that systematically compare AI versus traditional versus fuzzy wavelet-based approaches for MS. As well as many proposed methods are validated only on small lab-specific data set. Real-world clinical testing is rare or absent in this area. So when we move to the discussion part, fuzzy wavelet transform improves MS lesion detection accuracy in brain MRIs, outperforming traditional segmentation methods. It combines computational mathematics with AI, enabling early MS diagnosis and supporting timely clinical decisions. While it aids neurologists in treatment planning, adoption in real-world settings faces challenges like budget constraints and resistance to new technologies. This highlights the need for interdisciplinary collaboration to refine these methods and promote practical, patient-centered neurological care. So, finally, the future work. Looking ahead, several key directions can enhance the impact of this approach. First, through enhanced multimodal integration, we can combine fuzzy wavelet transform with advanced imaging techniques like PET and fMRI to improve lesion characterization and diagnostic accuracy. And secondly, by focusing on personalized clinical support, we aim to develop real-time AI-based decision support tools that assist clinicians in tailoring treatment plans for individual patients. Finally, for global validation and adoption, large-scale and diverse clinical trials are essential. So we must also address ethical and privacy concerns and invest in training clinicians to support the global implementation of these technologies. So together, these steps can bring this research from the lab to real-world clinical practice. So next, thank you for watching.